I'm Gordon Cottrell. I work at the Transportation Security Administration. I'm a federal officer.
He has a very physical job. He works at the airport.
His job entails a lot of lifting, pushing, pulling.
I lift bags all day long, which is a very strenuous and heavy job. You know, bags are usually from 50 pounds to 100 pounds on average, and lift about 600 of them in a day.
He did have an injury to his spine.
I was stepping over a bag at the time, carrying another bag and setting it on the table, and it caused an injury in my back. And I had two ruptured discs in my back.
Pain level was pretty high. I don't know the exact number. You know, it was probably 7, 8.
And stick a pin in your back and just keep pressing it in on your back. That's what it felt like, that constant pain like that. So it was tough.
Dr. Schlesinger likes to take also a very conservative approach to treatment.
Our goal here at Legacy Neurosurgery is to offer the most conservative treatment plan that we can.
Dr. Schlesinger does not want to rush into surgery unless he absolutely feels that that's the very last resort.
The least invasive treatment that will work, that will solve the problem or has a reasonable chance of solving the problem.
And we treated him conservatively with injections, with physical therapy, with strengthening program. He did very well.
The shots did help quite a bit. They helped alleviate the pain for a long time. And then, but eventually the shots, it was to a point where it wasn't quite helping me enough, and it started to get to where the shots weren't even helping me.
And unfortunately just chronically had a continuation of his problem, and it progressively worsened to the point to where the conservative treatment was not helping him, and he did end up having to come in and have a surgical procedure done.
With the surgery, he did better, and he was still having some pain.
But after that, I started working physical therapy here, doing the Med-X machine. And
we've treated him, you know, with therapy, and we treated him with Med-X.
A special program here, it's called the Med-X machine. There's only a handful of them in the entire state of Arkansas.
We're really lucky to have this equipment. It was developed in the University of Florida for their athletes.
It's specifically designed to test and strengthen the deep spinal muscles of the lower back, and then we have another machine to test and strengthen the deep spinal muscles of the neck.
So we really focused on the Med-X with him, on really triggering, getting those really deep, stabilizing muscles strong. And we did the program, and he's been doing great.
Very good results with that.
That started out at 120 and I was able to do it about 20-25 times, and I moved up to 230 pounds, and I was able to do it about 80 times.
So thankfully the procedure was very successful, and he did well with it. And so then afterwards we have seen him extensively for integration back to his work activities.
So it was a major difference. I don't take anything now, no medicines.
And you can tell when they're starting to feel better, they're doing more things.
His strength is back to normal, and he's back functioning and doing everything he wants to be able to do.
So I'm a lot better, I would say.